you. I'd like Anne Mundell-Noel to come up, please. She is going to introduce our speaker, our very special speaker. Again, Anne Mundell-Noel is our audiology advisor. There we go. Anne, there you go.
Thank you, Tony. Oh, there's more light here than I expected. Okay, good morning, good afternoon. Can you tell where my mind is at? October is Audiology Awareness Month, and with that, I have the privilege of introducing a friend and colleague of mine. Dr. Stephani Rose obtained her doctoral degree in audiology from UCSD and San Diego State University. She received her bachelor's in speech language, hearing science, with an emphasis in audiology. Dr. Rose is a full-time treatment audiologist at the House Clinic, which is now called the House Providence Hearing Health Center. That's a mouthful. She has a passion to help patients hear better by measuring their performance in noise and applying this information to the types of devices and accessories they will need to do their best, including cochlear implants. That sounds like she's doing that quick SIN test, right, that we all know about? In her spare time, Dr. Stephani Rose loves propagating and planting interesting succulents. Ooh, with Halloween coming up, I'm sure she's going to make some great ones. Today, she will be speaking about hearing loss and cognitive decline. She will also update us on the newest hearing device technology. Let's welcome Dr. Stephani Rose.
Hi, everyone. Thank you so much for having me. I'm sure there are some previous students of mine in the room that may have already seen some of this presentation, but that's okay. I have added a couple new things. So while Tony's getting that set up, I just want to say thank you again for having me, and I will try to get through this without putting any of you to sleep. I have some good pictures, so we'll go ahead and start. I don't know that the batteries were in here, right? Let's see. It doesn't look like it's on. These may have been, well, it's not. There's no lights. Oh, yeah. When all else fails, turn on the clicker. Yeah. Okay. So hearing loss and cognitive decline. So I am with House Providence Hearing Health Centers, formerly House Ear Clinic. And I'd like to start off by talking about what is an audiologist. And for all of you that would like to know how not to spell healthcare, it's with a hyphen. So we are basically evaluating, diagnosing, and treating both hearing loss and balance disorders. We also treat tinnitus, or ringing in the ears. Audiology is actually a very well-respected profession stemming from World War I. But now we are all operating at the doctoral level or master's degrees converting to doctoral level of practice as of 2012. So today I'm going to be talking about the effects of hearing loss, how this relates to our brain, and then also some research that has come out to provide us some data. So the bottom line is that listening does take effort. We hear with our we hear with our brains, not just our ears. This is a wonderful slide that David Magee, my Oticon rep, has provided me with. But basically, your two ears gather information, send that into a neural impulse up to your brain. Your brain then has to decide what types of sounds these are and make sense of it. And this has a lot to do with your memory. So your brain makes sense of sound. It's hardwired to receive certain things to make sense of the sound. But when it doesn't get the correct details, it has to work harder. And this means that your listening effort is increased. So, hearing loss does affect the brain. And I'm sorry, I can't see the laptop. I need to have my eyes checked. So, your brain receives less sound information when you have hearing loss. That makes it harder for your brain to recognize the sounds. And then you have to basically guess what people are saying, and that forces you to concentrate even harder. How many of you in the audience feel like you're incredibly tired after you go to one of your social functions? So some of that is not only staying up late the night before, but it's your hearing. So that extra effort that you have to do to make sense of the sound means that you have less mental capacity to remember the conversations that you're having. This makes you feel more tired after conversations, and then what happens? We're tempted to withdraw. I think I'll just stay home from book club today. I didn't get much out of it last week anyway. Sound familiar? So, common signs of hearing difficulty. How many here think that everyone else is mumbling? Right. Well, it does make it harder to follow conversations, especially when it's a complex environment. What do I mean by complex? Well, a lot of that has to do with the acoustics of the room, how much the sound waves are echoing off the walls and the floors and the tables, and how much background noise there is. So people rustling their papers, having their own side conversations, cell phones randomly going off during meetings, this kind of thing. So what happens is that what we find is that people tend to limit their social activities because it's just too darn difficult to communicate. So what is mild cognitive impairment? Has anyone ever heard of MCI? Okay, a few of you. So when we age, we all have some sort of normal cognitive decline. And then at the other end of the spectrum, we have things like dementia. But in between those two things is something called mild cognitive impairment. So basically, this can involve problems with memory, language, thinking, judgment that are more than just the normal age-related changes. What is dementia? It's very common. It affects 3 million people per year for new cases. Treatment can help, but as of now, there is no cure. It is chronic, meaning it lasts for years, or it can be lifelong once you're diagnosed. It requires a medical diagnosis, so lab tests are involved, such as imaging. Sometimes family history is also important. So I want you all to know that dementia is not a specific disease. It is a collection of symptoms that involve an impairment of at least 2 brain functions, such as memory and judgment. Symptoms can include forgetfulness, limited social skills, thinking abilities that are impaired to the point where it interferes with your daily functioning. Medications and therapies may help to manage the symptoms, but some causes are reversible. There's only like one though, and you'll see. So what's the role of the audiologist? Oh, by the way, on the opposite side of the flyer that has my picture, I went ahead and put out some nice facts that you guys can take home to remember for later. So the role of the audiologist, one of the first communication difficulties, one of the first signs of dementia is a communication difficulty. And audiologists are responsible for kind of seeing when that is more than just normal age-related symptoms and making that timely referral. If we can make a timely referral, that can help to improve your long-term outcomes, provide an earlier diagnosis, and help to better manage the cognitive decline. Statistics on hearing loss and dementia. So hearing loss is the third most common health problem in the US, next to arthritis and heart disease. Did you guys know that? Third most common problem. 1 in 3 people over 60 have hearing loss, and I liked Tony's kind of breakdown of the different age groups. 1 in 6 baby boomers have hearing loss, so all that rock and roll is adding up. Very few people have no cognitive decline with age, so that's something to note. In 2010, 4.7 million people over 65 years old in the US had the most common form of dementia, which is Alzheimer's disease. Raise your hand if you know someone who has Alzheimer's. Okay, so, you know, all of us have met one person with this disease. In 2016, this number went from 4.7 to 5.4 million. And by 2050, 13.8 million Americans are expected to have this. There's a large overlap of older adults who have both hearing loss and cognitive decline. There are 10 plus forms of dementia. When I was first getting into this subject, I had no idea. I thought that there was maybe 1 or 2, but I had no idea that there were 10 or more, and we're finding more and more every year. Again, the most common cause is Alzheimer's. I'm just going to kind of run through these, and then I'm going to go through each one individually. You guys may recognize some of these things, like Parkinson's. I had no idea Parkinson's was related to a form of dementia. So we'll start with the Alzheimer's. So most common form, 2/3 of all cases. Basically, there are these things called plaques and tangles that end up developing in the brain to stop information from carrying through to the next cell. The first symptom is short-term memory loss. Now, I don't want you all to get scared and say, oh, you know, I forgot to turn off the coffee pot yesterday, I must have this. So that's not right. You have to be diagnosed by a medical professional, and I am not a neurologist, so I just want to put that out there. I am here to talk about the hearing aspects and to give you some background on what this is all about for the cognitive decline aspect. So, other symptoms of Alzheimer's include difficulty learning new information, problems thinking, poor judgment. A lot of this is frontal lobe aspects of the brain in planning. We also have confusion, difficulty speaking, and then personality and behavior changes. I think that the personality part is probably one of the most depressing aspects of this, but just know that there are things that you can do to help improve your situation. Of course, if you're genetically programmed to wind up with something like this, you know, you can only do what you can do. So I also learned that the physical changes in the brain with the plaques and the tangles, they actually develop many years before you would ever have your first symptoms of Alzheimer's disease. The average life expectancy is about 8 to 12 years after diagnosis. This next dementia I'm going to talk about is called dementia with Lewy bodies. This is the second most common cause or common type of dementia. It's due to abnormal protein structures called Lewy bodies that build up in the brain and actually causes the brain cells to die. This can develop after many years of Parkinson's disease. I had no idea that those two things could be related. So this one is a little bit more obvious, where someone is having visual, what they call complex hallucinations. Also fluctuating alertness and motor symptoms that kind of mimic Parkinson's disease. So you'll have a kind of an unsteady gait and maybe stiffness and a flexed posture. People with this are at increased risk for falls, right? And the average life expectancy is It's just 7 years after symptoms appear. Another form of dementia is vascular dementia. This is usually caused by having either several little strokes or one large stroke, and it has to do with the blood flow and getting the information to and from different portions of the brain being obstructed by this blood flow problem. Next, we have frontotemporal dementia. This is about 10 to 15% of all dementia cases. So there is a group of neurodegenerative disorders affecting the frontal and temporal lobes of the brain. So again, more planning issues, and typically it affects younger people, so 45 to 60-year-olds. Kind of interesting for this one. The tau protein collects in the brain, creating tangles and causing cell damage. So these proteins are tau, T-A-U. Parkinson's disease. So again, this destroys nerve cells that make dopamine. And dopamine is a chemical that helps your brain cells to communicate with one another. These, we've learned, are from abnormal deposits of a particular protein called alpha-synuclein. These are called Lewy bodies. So again, those two are kind of interconnected. The symptoms begin with movement issues, so resting tremors, shuffling gait, stooped posture, and that progresses to memory loss, unfortunately, and the inability to pay attention and make sound judgments. This develops gradually, though. It starts after age 50, and it affects more men than women. So it does have a gender bias. Huntington's dementia. So also known as Huntington's chorea or Huntington's disease. This is a hereditary progressive brain disorder that's actually caused by a gene. This causes changes in the central area of the brain that affects movement, mood, and thinking skills. And it develops also quite early, between 30 and 50 years old. The average life expectancy is just 15 years after diagnosis. The next type of dementia, I had no idea that this could cause a dementia, but it's actually traumatic brain injury. So it's caused by an impact to the head, which basically disrupts the normal brain function. And that's usually caused by falls, car accidents, anywhere where your head is hit very hard. After this, depending on which area of the brain it's affecting, you may have some cognitive abilities like learning and thinking skills that are impacted. And it's got a range, so it's mild, moderate, and severe in terms of the TBI, or traumatic brain injury. Symptoms may include unconsciousness, confusion, disorientation, difficulty remembering, headaches, dizziness. This one has a lot of symptoms with it, and a lot of them kind of overlap with the other types of dementias that we've learned about today. This is a mouthful, and please, if there's anyone in the audience that knows how to say it better, feel free to raise your hand. I'm going to say it's called Wernicke-Korsakoff syndrome. This has two different stages of the same condition, and this is the one that's caused by a vitamin B1 deficiency. This is associated with malnutrition and also alcoholism. So, treatment is medically monitored. You have to go to the doctor. I would not advise you to try any of this on your own if you think you have this condition. But basically, a person has to stop drinking alcohol and take some vitamin B1. This will resolve many of the symptoms except for memory loss, which is permanent. The next type is called a mixed dementia. So basically, the symptoms and damage depend on which types of dementia you have. And there's more than one type, and they have to occur at the same time. The most common types that occur together are Alzheimer's disease, vascular dementia, And then also the dementia with Lewy bodies. This is actually more common than previously thought. Autopsies have shown that 45% of people with dementia have some sort of mixed dementia. So usually it's both Alzheimer's disease and vascular dementia. So all of this has to do with blood flow. I mean, a lot of it has to do with blood flow, and I mean hearing loss as well. So the average life expectancy is going to depend on the type of dementia and also how severe they are. This next one, I just want you guys to know that this is not a plug for you not to have surgery. If you need surgery, listen to your doctors, talk to your family, okay? So, post-operative cognitive dysfunction. Basically, it's a decline in cognitive function that can last for weeks or months, or even maybe become permanent after someone has surgery. People with undiagnosed dementia or mild cognitive impairment are at higher risk of having post-operative cognitive dysfunction. This can cause problems with memory, concentration, comprehension, or language ability. There's no specific cause, or there's no known specific cause for it, and the research does show that there's no difference between local or general anesthesia. Also, the length of surgery is not a factor. Open heart surgery patients are at a greater risk of developing this versus those who have had other long and complicated surgeries. So again, it's more about the cardiac system and the blood flow for this specific dementia. So people that experience this at their discharge will have an increased risk of dying within the first 3 months following surgery. I know, right? Best story of the year. Let's shift gears. Now that we've learned all we can about dementia, we're going to talk about the causes of hearing loss. So the most common one amongst you folks is going to be presbycusis, or age-related hearing loss. We also have socioacusis, which is noise-induced hearing loss. There's also congenital or genetic hearing loss, and we can actually see on the audiogram, which is a graph of your hearing, if any of these things are present. So I did my rotations at the VA hospitals during my doctoral program in San Diego, and we could see if a veteran had had noise exposure by having a noise notch, is what we call it on the audiogram. It's a little bit harder as they age because then age kicks in and then it becomes a slope. Congenital hearing loss can present in the form of what we call, oops, drop the remote on the ground. Sorry, guys. So the congenital hearing loss looks like a cookie bite. Can I move this forward? U shape on the audiogram. I think it went to the next slide. Forgive me, just a moment. I'm sorry, Tony. Or drug-related hearing loss. This can be due to chemotherapy, any of the mycin antibiotics, or abuse of opiates. Who knows Rush Limbaugh? So hearing loss risk factors. If you smoke cigarettes, you have a 70% higher risk to have hearing loss versus non-smokers. So that's one thing you're in control of. Diabetes. Hearing loss is twice as common versus non-diabetics. So pre-diabetics also show a 30% higher rate of hearing loss versus those with normal blood sugar. So again, blood flow, right? Heart health. Inner ear is extremely sensitive to blood flow. So studies show inadequate blood flow and trauma to blood vessels of the inner ear can contribute to hearing loss. Hypertension. There is a significant association between high blood pressure and untreated hearing loss, and hypertension sometimes can be an accelerating factor of hearing loss in older people. So here are some things that you may have not known. So effects of untreated hearing loss. Memory. You're more likely to develop problems with thinking and remembering versus adults with normal hearing. How could you be expected to remember what you talked about if you can only hear about 50% of what was said? Degraded hearing can force the brain to devote too much energy to processing the sound, and then you can't remember. Also dementia, we'll talk more about that next. Falling. Falling has been mentioned several times during this presentation or session today. And we have some preliminary research that people with mild hearing loss are 3 times more likely to have a history of falling. And then for every 10 decibels of hearing loss beyond that mild category, this increased the chance of falling by 1.4 times. There's some new research that's happening, and I can't report on it, where people are doing some balance testing with and without hearing aids, and people are actually able to hold a sharpened Bromberg longer when they have their hearing aids on, or stand on 1 foot longer when they have their hearing aids on. That's because our brain uses our eyes and our ears and what is called proprioception to tell where we are in space. And if you're down a sense, one of those 3 things, it's going to be more difficult to balance. So mental health. Adults over 50 with untreated hearing loss are more likely to report depression, anxiety, anger, frustration, emotional instability and paranoia, less likely to participate in social events versus those who wear hearing aids. And what's interesting is the degree of depression or the degree of these other things is directly impacted by the severity of the hearing loss. So the more hearing loss you have, the more likely you are to experience these mental health issues. And then tinnitus. About 90% of people with hearing loss also have ringing in the ears. Who here has ever had tinnitus? Raise your hand. That's a lot. That's more than half the room. So, next I'm going to talk about a study that's related to the brain and hearing loss. This study was done by Johns Hopkins and the National Institute of Aging. This is in 2014. This is part of a meta-study called the Longitudinal Baltimore Study of Aging. This had 126 participants that they looked at. And every year, they did some MRIs of these people over a 10-year period. So Frank Lin and his colleagues, that's the breakdown of the participants there. So 75 with normal hearing and 51 participants with at least mild hearing loss. They saw faster rates of brain atrophy in the hearing loss group versus the normal hearing. The hearing impaired group lost more than 1 cubic centimeter of brain tissue each year versus normal hearing. Now, in school they tell you, don't say use it or lose it. But this study kind of tells you that, right? There's significantly more shrinkage in brain areas for processing sound and speech. They also play a role in memory and sensory integration. This has also been shown to be involved in the early stages of MCI and Alzheimer's. Another study in 2011 by Frank Lin looked at even more participants over an 18-year period, also pulling from the Baltimore Longitudinal Study on Aging. The age range was 36 to 90 years old. And they were all dementia-free at the start of the 18-year study. Basically, the risk of incident dementia increased with the severity of the hearing loss. So, compared to normal hearing, there is the increased risk of dementia was 2 times for mild hearing loss, 3 times for moderate hearing loss, and 5 times for severe hearing loss. Alzheimer's disease risk also increased by 1.20 per every 10 decibels of hearing loss. So that's really just teasing out that severity portion there. So, take-home conclusion, hearing loss is independently associated with incident all-cause dementia. When hearing loss is a marker for early stage dementia, or whether it is an early marker or it's actually a modifiable risk factor for dementia, deserves further study. So I just want to underline that this is all correlation. We can't say if it's the chicken or the egg yet. And in 2020, Frank Lin is going to be releasing his own study on treatment effects of hearing aids and dementia. So you can look that up at the NIH. So then we went along touting that study for a little while, and then this study came out of France. In 2015, the Journal of American Geriatric Society took a look at 3,600 plus participants in France. They gave these people surveys. Some of them reported some major hearing loss, about 137. 1,100 reported moderate problems, so, difficulty in restaurants and things. And then about almost 2,400 reported no hearing trouble. So the results, self-reported hearing loss significantly associated with greater cognitive decline during the 25 years. This was independent of age, sex, and education. Those with hearing loss who did not wear hearing aids showed a steeper rate of cognitive decline. And here's the best part. Those with hearing loss who wore hearing aids had no difference in cognitive decline when compared to those with normal hearing. So that is the takeaway. If you leave with anything today, it is that statement right there. So, conclusion, and this is quoted right out of that research article, self-reported hearing loss is associated with accelerated cognitive decline in older adults, and hearing aid use attenuates or lessens such decline. Here's another one. Effectiveness of intervention with hearing aids. So this is a 2015 study by Deal and colleagues. They addressed the hypothesis that maybe older people with hearing loss who use hearing aids have slower rates of cognitive decline. So once that initial survey got released from France, everyone's like, wait a minute, let's look at this some more. So it was a 20-year-long study, and they looked at those persons with hearing loss who did not use hearing aids, and then those who did. So the older people with moderate to severe hearing loss, which means over a 40 decibel hearing loss on the audiogram, they had poorer performance on things like memory, global cognitive function, versus those without hearing loss. They also showed decline on cognitive tasks over a 20-year period. And the greatest decline was in the group who did not use hearing aids. Persons with the same hearing loss who used hearing aids showed global cognitive decline only slightly greater than the decline in the normal hearing group. I hope that that makes sense. So overall, evidence supports that participating in cognitively stimulating environments is maybe an intervention for the management of dementia. Okay? Hearing aids allow cognitive and interpersonal stimulation and engagement. And for all the people who are millennials or zennials like me, I don't know what's going to happen to us because we're all buried in our smartphones, not talking to each other in real life. So that's going to be more research later to be had. By decreasing listening effort, so making it easier for you to hear in these social contexts, hearing aids allow patients to feel less exhausted after socializing and dedicating more energy for engagement with family and friends. I just have to say that the silent generation, the silent Jenners, and even some of the baby boomers really have this big stigma related to disabilities in general. I feel that my Zennial generation, the generation between Generation X and millennials, we remember what it was like to grow up without the internet. I grew up on a dirt road with an acre of horse property, and my mom rang a bell when it was time for me to come home from down the street from playing with my friend and her horses. So it's just really important that we all find ways to kind of guide us into the future and not fall behind socially, okay? It's important that you all be able to engage with each other and not feel like you have a disability just because you hear differently. And it's very important that you become your own advocate, like this gentleman here. If you need people to speak slower, then that's what you say. You don't have to tell them why. You can just say, it helps me if you speak a little slower. And you all may notice that I have a very fast cadence at times, but that's only because I'm excited. And then I have to step back and remind myself to slow down each word so it comes out clear. So that's the key. When you're speaking to people who are blurring all their words together, you just need to tell them to slow down and separate the words. Okay, I'm getting off my tangent about that. So, we see a significant improvement in other research in global cognitive function after cochlear implantation. So when hearing aids are no longer giving you the clarity that you need to maintain a social lifestyle, it's time to be evaluated for a cochlear implant to restore the clarity of speech. This will help cognitive function according to this research. So, more research is still needed to find out, though, if hearing aid intervention is a good protection against or helps to decelerate cognitive decline. We cannot definitely say that hearing aids prevent, delay, or slow cognitive decline because this is about evidence-based practice, right? We can say, though, that well-fitted hearing aids allow for people to cognitively engage in behaviors that are known to prevent, delay, or slow cognitive decline. So, with that being said, that's sort of the end of the cognitive decline / dementia aspects. But I hope that all of you feel a little bit more empowered and a little bit more informed to not look at those hearing aids as fancy drawer stoppers. Put them in your ears. It is now about sound medicine for your brain. And if you're only putting them in your ears to go to those restaurants and meetings at the Laguna Woods, that's like taking half a pill of sound medicine. You don't want to do that to your brain. It's no longer about hearing people better. It's about brain function, okay? So, speaking about technology and different things that are classic and also current and new technology, I wanted to talk a little bit about T-coils, also known as telecoil technology. So basically, just like Tony was saying, there is a copper wire around a room, and this coil works as a small receiver that picks up signals from an audio system that is hooked into the loop. This loop acts as an electromagnetic field. So if you had your T-coil on and you're outside this room, you wouldn't receive my signal. Induction loop systems transmit the magnetic energy to the T-coil equipped hearing aids through a wire that surrounds the audience. So just like what Tony was saying. And hearing aids that have an activated T-coil will be able to receive this signal. So with the advent of rechargeable hearing aids, you as consumers need to understand that there's maybe only one hearing aid company that has a rechargeable hearing aid that has a T-coil inside of it. Okay, so just be careful when you go to get your new next set that you specifically ask for the options that include T-coil. And if you wind up at a retail center that only has one maker, that maker may not have that possibility. So you definitely want to go to a center that has lots of options for you, okay? So, here I go talking about those rechargeable lithium-ion solutions. Basically, they are available in a receiver and canal type style. Most do not have T-coils. The new rechargeables can last up to 36 hours on one overnight charge. And the life of the actual battery that's encased and sealed up inside of that hearing aid lasts for about 4 years. Now that means you've got 4 years worth of full charges, and then maybe after 4 years you don't get as much use out of it. It'll still charge up and work, but it may not last as long as it did prior to that 4-year mark. Most companies will let you send in the hearing aid under a repair and get a new lithium-ion battery in there without having to buy a whole new hearing aid. But another thing, too, that we need to do in research within audiology and the neurotology community is study how long should you have a hearing aid for. I see patients all the time who come in wearing the same hearing aid and maker for like 9 years. And then even if we try that same maker but with a new computer chip, they don't do so well. It's really difficult to get the brain to adapt to new sound prescriptions. So that's something to think about and to research. How many of you have heard about the made-for-iPhone hearing aids? Okay, so a few. So raise your hand if you have an iPhone. Quite a few more, my goodness. So I just want you to know, when you get your next set of hearing aids, you should look into this technology that makes your iPhone into a remote control for your hearing aids. All right? This puts the sound coming in from a phone call directly into both hearing aids. And the audiologist can set the hearing aids so that your surroundings decrease and the phone signal increases. This has changed the lives for my hard of hearing patients who constantly have to have a caregiver make all their phone calls, set up all their appointments. Now they're able to do it themselves right through the iPhone. And you don't need any fancy classes. I by no means am an engineer of iPhones, but I can certainly break it down for you and speak your language when it comes to learning that new technology. I will also say that the iPhones that have a button, a home button, these are very essential for quick access to your hearing aid remotes. Okay. These made for iPhone hearing aids, for the first time, we don't have to wear necklaces around our neck to use the cell phone. We don't have to wear a necklace around our neck to hear the TV, or even a remote microphone for those who have very poor speech and noise understanding. So everything is, less tethered. You're more free to move about your room and your social event. And you can even get to different programs and use the iPhone as a remote microphone. So very interesting technology. If you're looking into getting a smartphone and you have hearing aids, most of them that are direct will do so with an iPhone. I think there's one maker that does a direct with Android, but the phone calls only go to one ear, and audiologists don't like that. And neither do the patients. Also, most of these made for iPhone hearing aids do not have T-coils, so you want to ask about that too. And it's not like we're trying to deprive you of this, it's just that we're at the mercy of the makers and the type of patents that they can obtain with this technology. So if one of them gets a T-coil in a hearing aid and patents it, then nobody else can have that technology until that patent runs out. Okay. There is a maker that now has remote programming. This is a brand new thing that's going on, and we're all trying to navigate around how we're going to implement this and offer this to the patients. But now, through your iPhone, if you're sitting at Applebee's or some other restaurant that you like, Ruby's, if it's really harsh or loud or something, you can send me a request right to my computer through your iPhone about your hearing aids. I get a little pop-up on my right-hand portion of the screen, and it says, Dr. Rose, please help, Ruby's is too loud in program 2. And then I can just open up your settings, change that program 2, make it more comfortable, and bam, it gets sent right to your iPhone, and that uploads to your hearing aids. Less trips to clinic, which is really essential for people who have a hard time driving. Thank you. Now, there's going to be rules with that. If it's been more than a year since you've been to clinic, I'm going to tell you, sorry, I can't make that fix. You need to come in here so I can look in your ears and screen your hearing. So there's rules. All right, the other new thing that I learned about at the recent convention for audiology is the first, I'll say, unattached bone conduction hearing aid. It's actually attached to your head with a sticker. It's like a little sticker thing, and then you stick this other device onto it, and it vibrates the sound to your ears. This is approved for conductive hearing loss, so middle ear hearing loss, and I believe it may be approved for single-sided deafness, which I'm going to be having a training next month on, but it's called the MED-EL Adhere. So it's by a cochlear implant company that has devised a new conductive solution. Oh, and I meant to say it's non-surgical, which is great for all of you that know what a BAHA is. All right, so you can either do nothing or go forward. I liked that sign. And then these are my references. Tony is going to post this on the website so that you guys can tear through it and take a look at the research if you want to. But that's pretty much it. Are there any questions? There's a couple questions in the back.
Okay, here we go.
Okay.
Hi there. I'm wondering, you mentioned about the iPhone, but what if you have an Android?
If you have an Android, you can still operate remote functions like changing programs and volume. You would just need a little accessory device to do the phone call portion, or streaming is what we call that.
What effect, if any, would exercise like walking have on the cognitive decline?
So I can't speak to the cognitive decline aspect, but I do know that your cochleas, the inner ear, the little hair cells inside are incredibly sensitive to blood flow. That's how they get all their nutrients, and that's how they live and survive. So cardio activity, with the approval of your medical doctor, is definitely good for your inner ears, and I don't see why it wouldn't be good for your brain, because it's all to do with blood flow.
The Apple Watch 4 will be introducing the electrocardiogram. It is also a cell phone without the presence of a cell phone. So the Apple Watch in itself, if you leave your iPhone at home, is a cell phone in itself. Will the Apple Watch 3 electrocardiogram interface with the doctor real time on the Apple Watch 4?
I am not a cardiologist, so I can't answer that question, but thank you so much for your information. I know you can control hearing aids with the Apple Watch.
Yeah, all the Apple Watches connect to the hearing aids that are made for iPhone. No, you have to, we're not, yes, if it's an Apple Watch, it should be able to connect. But we can't verify.
Any other questions about the presentation or hearing devices? Yes.
Thanks. I was just wondering what you were talking about on the hearing aids and how long you're keeping them.
Yes.
And is the brain like switching off after they're so old on learning?
So I think to some degree this has to do with, it's kind of like if you change furniture on a blind person, they're not going to know where all the stuff is, and they're going to have to remap where all of those pieces of furniture are. That's exactly what happens when somebody's been wearing a hearing aid for more than 5 to 7 years and we change it up. So you have to relearn how to hear through it. It's kind of like getting a cochlear implant. Not quite as severe, but, and that's going to... Absolutely, and that's when it's even more crucial to wear the hearing aid from the time you wake up to the time you go to bed for the first 6 months. and to just continue doing that.
Anybody else?
Anybody else?
Sam?
I'm wondering, VA issues a hearing aid, but they have little knobs on there, and you have 3 different settings on them. I just wondered, what are those for exactly?
The settings are going to be variable depending on how your audio, someone who has access to your programming, because they're all different. She was saying they'll give you a restaurant program. I have people that have golf programs, so it just depends on the audiologist and what you need individually. So you should have some literature or something written down that was given to you at your fitting so you can reference what they're for, or you just might need to go have a visit so you can brush up. Yeah.
Okay, thank you.
Sure. Anyone else?
I'm going to let this stop right now, because Stephanie, you'll stay, right? So after...
I do have to leave by 3:30 to get
Oh,
back
okay.
to clinic.
Okay,
I'm so
okay.
sorry. And there's lots of goodies on the back table for you guys.
Okay, so Stephanie, I have a little gift for you, and a thank you. It's just a token of our appreciation. Very small a token. And thank you so much. You know, I do presentations like this, and I went to Los Angeles and did a presentation. And, you know, it's a lot of work to drive and do the presentation. And so I appreciate all the effort that you made. Thank you.
Thank you so much.
Thank you.
Everyone. Have a wonderful day.